Somebody asked about bempedoic acid and asked for more details on whether they should be taking it. I'm Dr. Monica Agrawal. I'm a preventive cardiologist. So bempedoic acid, marketed as Nexlotexol, probably I'm saying it wrong, is a medication that's been shown in statin intolerant people to not only reduce LDL, but to have benefit in terms of heart disease outcomes. So that's really great. So we have another medication in our armamentarium that we can use in patients who can't take statins. But that doesn't mean that we should be switching people off of statins who are tolerant to statins and putting them on bempedoic acid, because statins have loads of data on them to show that they can improve mortality, good for cardiovascular outcomes, reducing LDL, stabilizing plaque. So these are the reasons we should stay on statins. If you have familial hypercholesterolemia, there is nothing better than a statin in terms of the effectiveness of bringing it down other than PCSK9 inhibitors. And so the combination of a statin and a PCSK9 inhibitor for familial hypercholesterolemia is optimal.